In April, Australia decided not to follow New Zealand in aiming to eliminate the virus.
It's still accurate, isn't it, that Australia's goal is flattening the curve, not total elimination?
That's exactly right. It's called the suppression strategy.
Although infections are growing in Victoria, dwarfing the first outbreak, around the country it's a different picture. Tasmania hasn't recorded a new case for 60 days. South Australia's gone more than 2 weeks without a new case. Elsewhere, most new cases are from returning travellers. Queensland and WA have both gone more than a month without any local transmission. Until July, New South Wales had enjoyed more than 2 weeks without recording any locally transmitted cases. Its current outbreak has been traced back to a Victorian. Given the success of most states and territories in stamping out the virus, there are now growing calls for Australia to change its strategy and pursue elimination.
That would mean, obviously, no gatherings, no protests, no trade, no returnees from overseas, no family reunions.
Well, we're joined now by Professor Tony Blakely. He's an epidemiologist at the University of Melbourne, and Professor Peter Collignon, an infectious diseases expert at Australian National University. Good evening to both of you, gentlemen. Starting with you, Tony. The federal government has made it very clear it is not supporting elimination because, in its view, it will essentially kill the Australian economy. As a supporter of elimination, is that, though, in your view, what's needed to try to tame this dreadful virus?
Well, elimination, it's costly in the first instance. So if we did 6 weeks of hard lockdown in Victoria and achieved elimination, yes, it would be harder. However, you then get a clear runway, a clear place where you can return to a more normal functioning society and a more normal economy, at least until such point as you have any viral reincursion or you decide to reopen your borders. So elimination in the medium to long term could be a lot better economically.
We hear a lot about elimination, sticking with you, Tony, about a concept, but for our viewers, what would it mean in practice? What would a hard lockdown mean in practice, achieving the end of elimination?
Well, elimination is no community transmission of the virus. You could still get stuff in quarantine. And to get there, well, 6 out of 8 states and territories have got there with the conditions of the last lockdown, but they were the less populous and less dense states like New South Wales and Victoria will probably need more. And that would mean tightening up the definition of essential workers, not allowing children back to school, because whilst children don't get very sick, they transmit the disease. Going harder as far as the shops. So, for example, having our hardware shops and our butchers open is probably not necessary. Those types of measures. But above that is leadership. Something like Premier Andrews coming out and saying, we are going for elimination, because we know from the New Zealand experience that changed the cultural norms. And then rather than when we get to 10 cases a day in 3 or 4 weeks, hopefully, rather than us saying, let's go back to the pub, we'll be going, let's knock it on the head because we're working to a goal.
Peter Collignon, as a supporter of suppression and I guess this stop-start approach we're seeing with the lockdowns in Melbourne, why do you believe that would work instead of trying to go all out and achieving elimination?
Well, I think the term elimination is a worry because if you eliminate an infection, everybody's expectation we can go back to normal. Well, I think that's very unrealistic because this virus is around everywhere in the world, and for us to think we can keep it out, I think is not realistic. I also think it's so mild in so many people, particularly 20 and 30-year-olds, that you'll have to wait a long time before you're fairly sure that it's eliminated, like probably a couple of months, with no transmission at all. And I think the problem is, even if you get elimination in some areas, which we probably have already achieved in Australia, I might say, it is so easy for it to come back. And if people believe it's eliminated and aren't continuing to do the practices of hand hygiene, but particularly physical distancing, keeping crowds down inside, when it does come back, it'll bite you much harder. So I think it's much more sensible to go for a suppression policy. It may well cause elimination eventually, because if you look at most of Australia, we had very low levels and probably elimination in most of our states without doing the hard lockdown that Victoria did. And you can argue that the hardest lockdown has had the poorest results. So do you go with even a harder lockdown for longer? And there were even community outbreaks occurring at the beginning of May, which is while there was still a lockdown in Victoria. So I'm very sceptical that we'll be able to achieve elimination anyway. And the costs socially, economically and everything else are really substantial, and I don't think it guarantees we're not going to get a problem again in the future.
Well, Tony Blakely, picking up on that, talking about those other costs Peter just mentioned, we do know about the impact of recessions, people losing their jobs. We have mental health issues and, sadly, at worst, suicide. So there is another cost, isn't there? A human cost, a health cost, when we talk about elimination.
Yes, there is a cost. But the reason that I've come out now to argue for elimination is we're in lockdown anyway. So we're in a 6-week lockdown. So what I'm advocating for is going harder to maximise the chance of achieving elimination. Because if you achieve that elimination, I didn't say we'd go back to normal living, we'd go back to near normal living. So I agree with Peter that we'd still want to see people practicing good hand hygiene, keeping physical distance where possible in case the virus gets back in.
And Peter, there's a question, I guess, of fatigue, isn't there, if we pursue this suppression strategy, I guess, this whack-a-mole strategy of fatigue as we've seen with Melbourne people going back into lockdown again. How long can that be sustained realistically?
Well, I think it's a real problem sustaining it, because once you go through it and it doesn't work, look at California. They had a very hard lockdown and they've still got huge numbers of cases occurring. Now, they started off with much more than we did, in Australia. But I again look at Melbourne and I think, well, how long do you have to have a severe lockdown there for this? And do you extend that to Sydney because it's got a cluster of cases that look like it's getting under control? So I actually just think the costs of trying to do this without any success, because most things that we try and eliminate, if they're widespread around the world, we don't have success until we have a vaccine.
We'll have to leave it there. Peter Collignon and Tony Blakely, thank you both for joining us.
Thank you. I hope it was useful.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.